Have you ever noticed your cat acting a bit off when it comes to their behavior? Maybe they're fixated on certain objects or performing repetitive actions. They could be spinning around in circles, over-grooming in certain spots, or constantly chasing after invisible prey. If this sounds familiar, you may be dealing with something beyond typical feline quirks. Yes, we're talking about obsessive-compulsive disorder, OCD, in cats. It's not something that comes up often in discussions, but it's a real condition, and if left unaddressed, it can affect your cat's well-being. The truth is, OCD in cats can be hard to spot, especially since many of the symptoms overlap with common behaviors. But if you understand the signs, you can make sure your cat gets the attention and care they need. Imagine this. You're sitting on the couch, enjoying a peaceful evening, when suddenly your cat starts to compulsively lick a particular spot on their paw. Hours pass, and they're still at it. This repetitive behavior, though subtle, can actually be a sign of a deeper issue that could stem from stress, anxiety, or even an underlying medical condition. So, what should you look out for? How can you tell if your cat is simply being quirky, or if there's something more concerning going on? Let's talk about the signs of OCD in cats and what you can do about it. 1. Repetitive grooming. First and foremost, one of the most common signs of OCD in cats is over-grooming. Now, grooming is something that cats do naturally. It's a way of maintaining cleanliness, self-soothing, and even keeping their fur in top condition. However, when your cat's grooming habits become excessive and they are obsessively licking, biting, or chewing a specific area, it could be a sign of OCD. If your cat is constantly licking the same spot, it might start to cause bald patches, scabs, or even open sores. This could lead to more severe skin problems and infection, especially if your cat can't seem to stop. But what causes this obsessive behavior? Well, stress is a big factor. Cats are creatures of habit, and any change in their environment, routine, or even the people around them can trigger stress-induced behaviors. This could be something as simple as a new piece of furniture, a recent move, or even a change in your work schedule. Cats also feel stress from changes in their social environment, like the arrival of a new pet or family member. If your cat has started to exhibit excessive grooming habits around the same time as any of these changes, it could be their way of coping. 2. Tail chasing and spinning. Another common sign of OCD in cats is tail chasing or spinning. You might have seen your cat repeatedly chasing their own tail or spinning in circles for long periods. It might seem like they're just playing, but if it becomes excessive and appears compulsive, there may be more going on. This behavior is sometimes linked to anxiety or boredom. In some cases, it could even stem from a neurological issue that causes them to focus obsessively on their tail. While some cats will naturally bat at or chase their tails occasionally, an ongoing obsession could indicate that the cat is struggling to regulate their emotions, which often manifests as compulsive behavior. 3. Incessant scratching or clawing. We all know that cats love scratching posts or furniture, but if your cat is excessively scratching a particular spot or even clawing at the air or the floor obsessively, that could be another sign of OCD. If your cat's scratching is accompanied by a high level of anxiety, or it leads to injury or marks on their skin, it might be time to investigate further. Constantly clawing at an object may be a way for your cat to release built-up tension or frustration, and when the behavior becomes repetitive, it might be indicative of a compulsive disorder. 4. Hunting invisible prey. You know how your cat seems to hunt in the middle of the room, pouncing at nothing, staring intensely at empty spaces, or running after invisible prey. While some cats have a naturally high prey drive, if this hunting behavior becomes obsessive and continues for extended periods of time, it could be an early warning sign of OCD. This behavior often stems from an overstimulated mind and can occur if your cat doesn't have enough mental or physical stimulation. Cats are natural hunters, and if they aren't able to express this through normal activities, they might begin hunting the air, their toys, or shadows. 5. Excessive meowing. Meowing is normal for cats, but if your cat is meowing excessively, especially if they seem to be talking to nothing, it could be another sign of an obsessive behavior. Sometimes, cats will meow as a way to express anxiety or stress. If they're meowing continuously at the same time each day or for no apparent reason, it could be their way of coping with mental discomfort. This behavior may also become more intense if your cat feels ignored or if there is a lack of engagement or attention. 6. Self-mutilation. When it gets more severe, OCD can lead to self-mutilation. Cats who obsessively bite, lick, or chew at themselves can cause significant harm to their bodies. In these cases, they might even cause bleeding or create infections in the areas they've targeted. If you notice your cat engaging in these kinds of behaviors, it's important to seek veterinary help immediately. The longer these behaviors go unaddressed, the harder they are to break, and they could lead to permanent damage to your cat's skin and fur. So, what's behind all of this? What causes a cat to develop OCD-like behavior? While we don't have a definitive answer, several factors contribute to this condition. 1. Stress. As I mentioned earlier, stress is one of the biggest triggers for OCD behaviors in cats. Stress can stem from a variety of sources, such as changes in the home, environmental shifts, or new family members or pets. Cats are creatures of habit, and disruptions to their routine can cause anxiety. 2. Boredom. Cats are incredibly intelligent creatures, and without proper stimulation, they can become bored. Boredom often leads to repetitive and compulsive behaviors. If your cat is left alone for long periods, especially in a less stimulating environment, they might resort to excessive grooming, scratching, or chasing imaginary prey. 3. Health problems. Sometimes, compulsive behaviors can be triggered by an underlying health issue. Conditions like skin infections, allergies, or joint pain can cause discomfort, leading your cat to repeatedly lick or bite certain spots. A veterinary examination can help rule out any physical problems that may be contributing to the behavior. 4. Genetics. Just like people, cats can inherit certain traits. Some cats may be predisposed to developing OCD behaviors, especially if they've been bred for specific temperaments or traits. However, even if your cat has a genetic predisposition, it doesn't mean they'll automatically develop these behaviors. Now that we know the signs of OCD in cats and some potential causes, let's talk about what you can do to help your furry friend. 1. Increase mental and physical stimulation. One of the best ways to prevent OCD behaviors is to make sure your cat has plenty of mental and physical stimulation. This can come in the form of interactive toys, puzzle feeders, and plenty of playtime. Try rotating their toys regularly to keep things exciting and engaging. 2. Create a safe and calm environment. Since stress plays a major role in OCD behaviors, creating a calm environment can help. Make sure your cat has a quiet, safe space where they can retreat when they're feeling overwhelmed. If you've recently introduced a new pet or family member, be patient with your cat as they adjust to the changes. 3. Use Feliway diffusers. Feliway diffusers are synthetic pheromones that help calm cats and reduce anxiety. They can be a helpful tool in managing OCD behaviors, especially if stress is a significant factor. 4. Provide regular veterinary checkups. If you're concerned about your cat's obsessive behaviors, a trip to the vet is always a good idea. They can rule out any medical causes and provide advice on how to manage the behavior. 5. Create a routine. Cats thrive on routine. Try to keep feeding times, playtime, and other activities consistent to reduce stress and uncertainty. Knowing what to expect each day can help your cat feel more secure and less likely to engage in compulsive behavior. If you've noticed your cat exhibiting any of these obsessive behaviors, don't ignore them. While some quirks are completely normal, compulsive behaviors like overgrooming, tail chasing, or obsessive meowing could be signs of deeper anxiety or stress. With the right care and attention, you can help your cat break free from these habits and lead a happier, healthier life. Remember, your cat's well-being is in your hands. It's essential to stay observant and be proactive. If you suspect that your cat may be dealing with OCD, don't hesitate to consult with your vet. They can help you understand the root cause of the problem and guide you in managing the behavior. Thanks for watching. If you found this information helpful, don't forget to subscribe for more tips on keeping your cat healthy and happy. Your cat depends on you, and together, you can make sure they live their best life.